Welcome back to another lecture with future CRNA learning solutions. You've already been introduced to pharmacology, induction agents, and inhalation agents. Now, we're going to take a step back and understand where all of this began. Anesthesia is the foundation of modern medicine. Without it, surgery as we know it today would not exist. The word anesthesia comes from the Greek meaning without sensation. But in reality, anesthesia is much more than that. It's not just about removing pain, it's about controlling consciousness, physiology, and the entire human experience during surgery. As anesthesia providers, we don't just put patients to sleep. We protect their brain, their heart, their airway, and ultimately their life. And everything you learn moving forward in this course will build on that idea. Modern anesthesia is made up of 4 key components: hypnosis, where the patient is unconscious; analgesia, where the pain is controlled; amnesia, meaning no memory of the event; and muscle relaxation, allowing optimal surgical conditions. This is extremely important early on. Anesthesia is not just one drug. It is a carefully balanced physiological state created by multiple medications working together. For example, you might use propofol for hypnosis, fentanyl for analgesia, and a paralytic for muscle relaxation. Each drug has a specific role, and your job as a future anesthesia provider is to understand how to combine these safely and effectively. That's where the art and the science of anesthesia begins. Long before modern anesthesia, humans still needed ways to manage pain. Ancient Egyptians used opium mixed with alcohol. The Chinese developed acupuncture and herbal sedation techniques. The Greeks and Romans used substances like mandrake and belladonna. But here's the key issue. These methods were inconsistent, unpredictable, and often dangerous. There was no control over dose, no monitoring, and no real understanding of physiology. These patients often experienced severe pain, and many didn't die from the surgery itself. They died from the physiological stress response to pain. Massive catecholamine release, tachycardia, hypertension, eventually leading to total collapse. So anesthesia didn't just improve comfort, it improved survival. The true turning point in anesthesia came in the 1800s. In 1846, William Morton, a dentist, publicly demonstrated the use of ether during surgery. For the first time in history, a patient underwent surgery without pain, and this moment completely transformed medicine. Before anesthesia, surgeries were fast, chaotic, and traumatic. Surgeons operated as quickly as possible to minimize suffering. After anesthesia, everything changed. Surgery became slower, more precise, and more controlled. This allowed surgeons to focus on technique, not speed. And that shift is what laid the foundation for modern surgical practice. Once pain was controlled, medicine expanded rapidly. Surgeons could now operate for longer periods of time and on more delicate structures. This led to the development of neurosurgery, operating on the brain, cardiac surgery, operating on the heart, and organ transplantation. Think about that. None of this would be possible without anesthesia. So, again, anesthesia didn't just improve surgery, it made modern medicine possible. Anesthesia exists on a spectrum. Local anesthesia numbs a small area. The patient is fully awake. Regional anesthesia, like spinal or epidural, blocks larger areas of the body. On the other hand, general anesthesia results in complete unconsciousness, requiring airway and physiologic control. And in between, we have sedation. Now, this is critical clinically because your goal is not to give the most anesthesia. Your goal is to give the right amount of anesthesia. Too little, the patient feels pain or becomes aware. Too much, you risk hemodynamic instability, respiratory depression, or worse. This balance is what defines a skilled anesthesia provider. Today, anesthesia is incredibly advanced. We continuously monitor heart rate, blood pressure, oxygen saturation, and end tidal CO2. And we use this information in real time. Every medication you give has physiologic consequences, and you are constantly adjusting based on what you see. This is why anesthesia is dynamic, not static. You are making decisions every few seconds, sometimes quicker than that. Titrating medications, managing airway, optimizing physiology. That's what makes anesthesia both challenging and rewarding. As anesthesia providers, our responsibility spans the entire perioperative period. Preoperatively, we assess the patient, identify risks, and develop a plan. Intraoperatively, we manage physiology in real time. And postoperatively, we ensure safe emergence and recovery. So again, we are not just putting patients to sleep. We are managing life support. We are the constant variable in an otherwise controlled environment. Nurse anesthetists have played a critical role in the development of anesthesia dating back to the Civil War. And pioneers like Alice McGaw, who's the mother of anesthesia, safely administered over 14,000 anesthetics with remarkable outcomes. She helped establish safety standards that are still relevant today. CRNAs have always been leaders in patient safety, innovation, and clinical practice. And today, they remain essential providers across the country. The future of anesthesia is evolving rapidly. We're moving toward personalized medicine, tailoring drugs to each patient, AI-assisted monitoring systems, and pharmacogenomics, understanding how genetics influence drug response. But no matter how advanced technology becomes, it will never replace the need for a provider who understands physiology. Anesthesia is not just about eliminating pain. It is about controlling physiology, protecting the patient, and enabling modern medicine. Everything you learn from this point forward builds on this foundation, because before you can master anesthesia, you must understand what it truly is. Thank you for participating in another lecture with us. As always, feel free to message us or leave a comment for any questions or clarification you may have. Thank you, and good luck on your journey to becoming a CRNA.